Having a newborn is a wild ride. There are some things you can prepare for and some things that you just have to learn from experience. And I'm here to help you so you know the important questions to ask once you have a newborn. Now, I'm Erin. I'm a pediatric nurse practitioner and a certified lactation counselor, and I am here giving you bite-sized pieces of feeding information so that you can feed your baby confidently, whether they are bottle feeding, breastfeeding, or starting solids. Make sure to hit subscribe. I'm going to start from the very, very beginning. So, you just delivered your beautiful baby, like this guy. And they're like, why is your baby already wearing a shirt? Just kidding. Bad joke. Okay, so you delivered your baby and your OB hands you your baby and they say congratulations, and you're sitting there and you're crying and everything is pretty magical. In an ideal world, you have 1 hour with your baby without any interruptions. That time is great for skin to skin and initiating feeding. So whether you are bottle feeding or breastfeeding, that is the perfect time to start latching your baby or to give your baby a bottle. So that means you are attempting to latch and then feeding your baby from there on out every 2 to 3 hours until pretty much they go to college. Yeah, they eat a lot. Let's talk a little bit about milk production. So whether you intend to breastfeed or you intend to bottle feed, your body will start producing milk sometime around the 16th week of pregnancy. That means that if you are going to breastfeed your baby, you can latch them right away and they should have colostrum to eat. Colostrum is not a large amount, but the good thing is that babies don't need a lot of milk early on. So whether you're formula feeding or you're offering breast milk, babies really don't have large intake needs. So what I'd like you to do is learn about hunger cues. So hunger cues are one of the most important things that you can know about when you are learning how to feed a baby. And that is feeding a baby when they're showing you signs that they are hungry. Now, the signs that we think of are a baby's getting agitated or a baby is crying and then you need to feed them. But really, those are late hunger cues. So we want you to see the early hunger cues, which is your baby in more of an active sleep or opening their eyes, licking their lips, smacking their lips, tongue out, moving to the side, or trying to suck on their hands. So we want you to start initiating feeding or thinking about feeding your baby when they're doing signs like that versus the later times where they are a little bit more agitated or they are crying and then it's really hard to get a baby to latch. One of the things that kind of makes you not feel so great is that if you're giving your baby a bottle, oftentimes when they're frustrated, they will take a bottle, but if you're trying to latch, they won't latch, and that can make you feel a certain way as a mom. So we are back in the hospital bed and they hand you your baby and you think, okay, now it's the right time to initiate feeding. I have a great video on how to have your baby get the best latch possible, and I want you to watch that because it's really important and can help prevent a lot of nipple damage and a lot of discomfort in the early days, and it can really help your baby extract as much milk as possible. Now, they do not need a lot, but you also most likely are not producing a lot. So we're trying to get your baby to get a great latch every single time. I highly recommend that you see your IBCLC in the hospital or ask your nurse for a lot of assistance with latching in the beginning days. And let's say you are planning on formula feeding from the start. Your baby still doesn't need large amounts right away. So you might consider asking your hospital for ready to feed formula. Alternately, you can bring your own formula from home and you can prepare it. But your baby probably won't even need the little nursettes that come in 2-ounce increments. So you might be able to feed your baby somewhere between a half an ounce to an ounce in the first day and then go up there gradually as your pediatric provider recommends. Let's talk a little bit about what on-demand feed means. So this means that even though we hear that we need to feed babies every 2 to 3 hours, really it should be we need to feed babies on demand no longer than every 2 to 3 hours. So if a baby is showing you hunger cues at the hour mark or hour and 15 minutes or hour and 45 minutes, we feed the baby. So whether they're bottle fed or breastfed, if they are showing you hunger cues, you feed the baby. I'm often asked, how do we know a baby is getting enough? So in the early days, we are expecting just a few wet and a few poopy diapers. So on your baby's first day of life, they should have one wet and one poopy diaper. The poop is going to be dark and kind of sticky and kind of actually really gross. And that is called meconium. And then very, very normal for your baby to have that. Then, as your baby is getting more milk, they should have more wet diapers and more poopy diapers. So we're hoping that pretty much each day of life, your baby is having that many wet diapers. So that means on day 1, it's 1 wet diaper. On day 2, it's 2 wet diapers, 3, 4, 4. And by day 5, we hope your baby is not losing any more weight and having 5 to 6, but pretty much more than 6 wet diapers. Poop is a little bit more variable. We would like it to be however many days of life they are, that's how many poops they have. But sometimes if your baby is formula fed, they will have less poopy diapers and it will be more consolidated or larger amounts, and it might be darker colors. But we do want the poop to transition from this really thick, dark, brown, green, black meconium to more liquidy or looser or yellow, seedy, mustardy. There are lots of different ways to describe it, but it should transition hopefully by day 5 of life. Otherwise, we are hoping that your baby is gaining from 0.8 to 1 ounce per day every single day, at least by day 5 of life, that your baby is having good wet and poopy diapers, and that your baby's skin color is looking a little bit better, less yellow, that your baby doesn't have jaundice, and bilirubin levels are going down and not up. So all of those are the ways that we know a baby is getting enough to eat. Let me reiterate, it is never the wrong idea to call your pediatric provider if you have any concerns that your baby is not getting enough, or really any newborn concerns at all. If you have any questions, you can feel free to reach out to me. You can message me through YouTube. You can find me on Instagram at Baby Feeding Coach. And I am happy to help in any way. Make sure to hit subscribe. We will be talking about a lot of different feeding concerns and different pieces of education that I use while I'm working in clinic and with families all the time.